Ever wondered why some women have irregular periods or struggle with weight gain and acne? Could it be polycystic ovary syndrome or PCOS? Welcome to the world of polycystic ovary syndrome, a condition that affects 1 in 10 women of childbearing age worldwide. It's a complex disorder that is often misunderstood and misdiagnosed, leading many to live with its effects without knowing the root cause. PCOS is not just a reproductive health issue. It's a life-altering condition that can impact multiple areas of a woman's life, from physical health to mental well-being. It's associated with a wide range of symptoms, from hormonal imbalances leading to acne and hair growth, to metabolic issues like insulin resistance and obesity. Understanding PCOS is crucial, not just for those affected, but for everyone. It's about recognizing the signs, knowing the complexities, and learning how to manage it. So, stay tuned as we delve into the complexities and symptoms of this often misunderstood condition. Polycystic ovary syndrome isn't a one-size-fits-all condition. It's complex and varies widely from woman to woman. Diving deeper into the intricacies of PCOS, it's important to understand that this condition is fueled by a web of interconnected factors. At the heart of it all, PCOS is characterized by hormonal imbalances. This disorder is commonly associated with high levels of androgens, or male hormones, which can lead to a range of symptoms from acne and hair growth to irregular periods. But it doesn't end there. Many women with PCOS also have insulin resistance, where the body struggles to use insulin effectively. This can trigger the ovaries to produce even more androgens, further exacerbating the hormonal imbalance. Insulin resistance can also lead to weight gain, a common challenge for women with PCOS, and heighten the risk of developing type 2 diabetes. Let's not forget the role inflammation plays in this condition. Elevated levels of inflammation are often found in women with PCOS, contributing to insulin resistance and, once again, increased androgen levels. This inflammatory response can also affect multiple body systems, leading to an array of symptoms that extend beyond the reproductive system. PCOS can impact everything from your skin and hair to your mental health and metabolism. It can cause irregular periods, fertility issues, and even increase the risk of heart disease and endometrial cancer. The wide array of potential symptoms and health risks makes PCOS more than just a reproductive health issue. It's a systemic condition that requires a holistic approach to manage. That's a lot to take in, isn't it? The complexities of PCOS make it a condition that can look different in every woman, and that's part of what makes it so challenging to diagnose and manage. But don't lose heart. With the right knowledge and understanding of these complexities, it's absolutely possible to navigate this condition and live a healthy life. These complexities can make PCOS a challenge to diagnose and manage, but with the right knowledge, it's possible to live a healthy life. So, what are the signs that a woman might have PCOS? The symptoms can be as diverse as the women who experience them. One of the most common symptoms of PCOS, or polycystic ovarian syndrome, is irregular periods. This might mean that periods are infrequent, irregular, or even absent for several months at a time. It's a result of the ovaries not regularly releasing eggs, a process known as ovulation. Next on the list is weight gain or difficulty losing weight. Many women with PCOS find themselves battling with their scales. This is due to the hormonal imbalance associated with PCOS, which can affect the body's ability to regulate sugar and can lead to weight gain or make weight loss more challenging. Then there's acne, which isn't just a teenage concern. In fact, women with PCOS often experience persistent acne that can be resistant to standard treatments. This is because the body is producing too much of the hormone androgen, which can trigger the skin to produce excess oil, leading to breakouts. Another symptom that can be particularly distressing is excessive hair growth, medically known as hirsutism. This can happen because those with PCOS have higher levels of androgens, which can trigger hair growth on the face and body. Finally, let's talk about fertility issues. PCOS is one of the most common causes of female infertility. The irregular ovulation associated with PCOS can make it more challenging to conceive. It's important to remember, though, that having PCOS doesn't mean you can't have children. It just might require a different approach. Each of these symptoms can have a significant impact on a woman's life, affecting her self-esteem, body image, and overall well-being. It's not just about the physical symptoms, but also the emotional and psychological toll it can take. While these symptoms can be distressing, understanding them is the first step to managing PCOS effectively. So, if you recognize these symptoms in yourself or someone you care about, remember, Knowledge is power. With the right information and support, you can navigate PCOS and live a healthy, fulfilling life. Now that we've explored the complexities and symptoms of PCOS, let's discuss how women can manage this condition. Managing PCOS effectively involves a combination of lifestyle changes and medical interventions. Let's break it down. Firstly, lifestyle changes. Adopting a balanced diet can help regulate your hormones and manage PCOS symptoms. Incorporating foods like lean proteins, whole grains, and a variety of fruits and vegetables into your meals can be beneficial. And let's not forget regular physical activity. Whether it's a brisk walk, yoga, or a gym session, exercise can help decrease insulin resistance, a key factor in PCOS. On to medication options. There's no one-size-fits-all treatment here, as the type of medication prescribed often depends on your symptoms. Metformin, for instance, is commonly used to manage insulin levels, while birth control pills can help regulate menstrual cycles and reduce androgen levels. Lastly, we have to address the elephant in the room: mental health. Living with PCOS can be challenging, and it's essential to prioritize your emotional well-being. This could mean anything from practicing mindfulness, seeking counseling, or joining a support group. Let's circle back to the main point. Managing PCOS is a personalized journey. It's about finding what works best for you, in consultation with your healthcare provider. Remember, everyone's journey with PCOS is unique, and what works for one woman may not work for another. PCOS is more than just a reproductive disorder. It affects the whole body and can have long-term health implications. Its impact extends beyond fertility concerns, potentially increasing the risk for type 2 diabetes and cardiovascular disease. There's also an important, yet often overlooked mental health aspect, with increased cases of anxiety and depression reported among those with PCOS. Understanding PCOS is the first step to taking control and managing this condition effectively. Remember, you're not alone, and there are resources and support available to help you on your journey.